So I've been working on homelessness since I was 14 years old in the city. It's been probably the main issue when I went to college. I went to college in New York. The height of the kind of crack epidemic in Harlem, I started a group that was building housing. It's probably been the issue that's been the most important to me. And the longer I've worked on it, let me reframe the question because the city is never going to solve homelessness on its own. And that I want to be very clear. In no way that's no dodge on my responsibility. In fact, I said I take up ownership of the response to homelessness. The jurisdiction of the city government really isn't over any of the causes in or the cures out of homelessness. When you think about homelessness, I try to simplify it. It's trauma meets high rent, right? We have a little bit more influence on some of the rent stuff, but most of the causes in of trauma come out of foster care system. My wife and I are foster parents. I know it very well up close and personal, and the trauma of that, of veterans who are coming home from war, the longest war we've ever been in as a nation that still goes on. Sexual and domestic violence, particularly towards women, the trauma of a divorce, mental health and addiction. So all of those things usually are either in federal government or county government, right? County does all of our social services. They have the mental health, or should have the mental health programs, the anti-addiction, criminal justice system. The prisons are run by the state, the jails by the county. So, somebody once told me, and I stick to this, that the city is kind of like at the Rose Parade. Those folks who are dressed up in the cowboy outfits, but they're behind the horses, scooping up everything that falls out of their rear ends. That's kind of what the city's role is when it comes to homelessness. Like, we aren't necessarily feeding or producing it, but we are having to clean it up. And let me tell you, it is tougher and tougher. If you had told me 4 or 5 years ago that we would have put together the first plan ever on homelessness, the county would have, and we were working together instead of at odds, which we did for decades, that we would pass the largest measure for housing on homelessness at the local level in U.S. history, and then a second one less than a season later for the county level for services with a quarter-cent sales tax, that we would have done more affordable housing starts in the last 3 years than in the last 30 years, that we would have doubled the number of solutions coming off the streets in 3 years in terms of going from 24 outreach workers to nearly 350 outreach workers. Doing that, I would have said, great, you know what, we're going to be on our way home when it comes to homelessness. And yet, 2 years ago, we had a little dip down, but the last 2 years, it's gone back up. We've only seen it go up. So all of that is to say, and then I'm happy to get into the city stuff. If we aren't serious as a nation about a right to housing, we ain't going to get out of homelessness on our lifetimes. We'll see numbers come down. I know one of the questions, I think it was Jessica, you asked about in a good economy, homelessness goes up. I wasn't stating that as like an aspiration. It's just we've noticed in a strange and perverse way that a good economy can't build housing as quickly as jobs come back to an area. So let's say, in a city of 1 million people, there's suddenly, 1.1 million jobs. You can't build 100,000 units of housing quickly. So rents go up really quickly in a good economy. And that pushes more people out because people are asking, when a good economy, shouldn't we be housing more people? Ironically, the reverse happens. When the economy goes down, rents soften some or can, and more people come off the streets and homelessness goes down. It shouldn't be that way. I wasn't saying that aspirationally. It's just kind of what our experience has been, that the highest upticks happen ironically when the economy is at the strongest. But we have failed as a state to build enough housing. And I don't think Los Angeles at this moment, certainly not for the last 5 years, has failed to do our part. I'll give you a statistic. Los Angeles is building 25% of the housing in California, and we're 10% of the population. In LA County, we're 40% of the county population and building 75% of the housing. We've had all sorts of new tools to build a lot more affordable housing on the developers' dimes, mandating the dream for 30 years that Mayor Bradley had to force developers building market rate housing to pay an affordable housing fee. I got that through the measure HHH, which will produce 10,000 units of housing, about 1,500 of them just in the next 3 or 4 months, another 2,000 next year, 10,500 in the next 4 years. Like I said, in the last 3 years, more than in the last 30. I'm overwhelming you with a lot of numbers, but there is a piece that we have to build more supply in. And there are a lot of people say we just need density and more units at any cost, and they're kind of right at a certain level, because the more units you have, the more rents can come down, but we also need to subsidize more at the bottom. So I worked very closely in this campaign, first with Bernie Sanders to get on his agenda, and then with Joe Biden, who asked me to be his national co-chair in January, and the only thing I asked for, he had helped me raise the minimum wage and make community college free here and some amazing things. And I knew he was going to lose, but I'm a loyal guy and I endorsed him. People said, "You're so smart." I'm like, no, it's better to be lucky and loyal sometimes. But I had one ask. He said, "What do you want?" I said, "I don't need a title." And they gave me one. I said, "I need you to put in your agenda that Section 8 vouchers should move towards an entitlement." Now, for those of you who don't know, Section 8 vouchers are that voucher you get for housing if you're indigent. You have to qualify for it. But today in Los Angeles, 1 in 8 people who qualify get it. It's like a 10-year waiting list. In America, if you're hungry, we give you food stamps if you qualify, even though this president's tried to take it away, 100%. If you are poor and don't have medical care, you get Medicaid, 100%. We call it Medi-Cal here in California. But if it comes to housing, there's a 1 in 8 chance that when you qualify that you'll get it. So it's a lottery instead of an entitlement. And every country I've studied that's ended homelessness has literally said that they will take people off the street first and then deal with their trauma after. So I put that into Vice President Biden's platform. I hope that he wins, and I hope that will be it will be bigger than anything I could ever do as mayor. Put it that way. The second and last thing, and sorry for such a long answer, but homelessness deserves this, is mental health. We have so many well-intentioned policies in the past, in the 60s, that we had all these one flew over the cuckoo's nest institutions, so deinstitutionalized, and that money was supposed to go towards, instead, community-based mental health care. It doesn't exist. If 10 of us on this call get a broken leg, we can go to the emergency room and we'll get it fixed. 10 of us have an addiction problem. I doubt any of the 10 of us could get a program today, and especially if we have no money. So the mental health crisis that we're experiencing, that the worst off that we see who are experiencing homelessness are going through, is a tragedy upon tragedy upon tragedy. The glint of light is that this year we housed more people in a shorter period of time than we ever have, because finally the calls that I made, for instance, to have a FEMA-like response, FEMA said we could put people in hotel and motel rooms during COVID-19. We actually successfully have kept COVID away from people experiencing homelessness more than those of us who are housed. So to repeat that, the morbidity and infection rate is lower among the homeless population of Los Angeles than the housed population of Los Angeles. So yes, I'd love to see thousands and thousands more, but it's the worst budget year ever. And I think all of us have to be a collective voice saying at the national level, we need a mental health care system and a right to housing. And then see in the next 2 to 3 years, really all the things that we voted for and queued up begin to come online. But, when we house 25,000 people in a year, 25,000 real people, real souls whose lives are changed and housed, but your numbers still go up because 28,000 new people become homeless, we have to get to the root cause of the trauma that's happening. And it's not just displacement. That's a part of it. But there is also a huge amount of trauma that's going untreated and making it very difficult for people to come off the streets. I could probably do another hour on that, but I hope that addresses many of that. And by the way, a couple other things that were in there, like, we still have to clean streets. There aren't sweeps of people. In fact, there's some folks who have kind of protested and kept away COVID tests, showers, and services the moment when we ask people to put their tents together so we can clean the street and they can go back right now under CDC guidelines. There's a lot of stuff that's really important for us in terms of being able to not only take care of the crime being committed against people who are experiencing homelessness and the health conditions that they face, but I hope after COVID-19, we don't let people go back onto the streets. And when I say we, it's not just the city. That means the federal government and the state continuing the funding they've given us during COVID-19 so that we don't see 4,000 or 5,000 people that we've just housed in the last couple of months go back onto the streets.